So we're chatting about families. When I've conducted family therapy groups of families who have loved ones in rehab, in primary care, I've come across passionate mothers and fathers who don't understand what this thing is. And I've on 2 occasions had to put a stop to their passions getting out of hand, because a couple of dads got together and they said, well, our kids can't be to blame, so we are going out there and we're going to find the dealers and we are going to take them out. And this is never a good idea. When you go to rehab, we have no interest in who your dealers were, and we heal the person, because the sad fact is that there will always be dealers. If one is killed, there will be 4 or 5 others that just pop up. So taking the dealers out when you're a family is not going to stop your son or daughter from seeking drugs. You have to trust that in a rehab, in a reputable rehab, that we will teach your loved one how to live without drugs and how to cope without their main coping mechanisms, which have become drugs. So it's an education that families need, first of all, to accept that this is a disease. Their children aren't bad. They are addicted and cannot stop themselves from finding and using substances which they believe they need. So yes, please understand, families, that when your loved one is in a rehab, in a primary treatment program, that we are not interested at all in getting numbers and pointing fingers at who the dealers are. We look at completing the person and creating a healthy person from a sick, addicted person, and a person who has choices and who can actually implement tools that they learn in rehab rather than reaching for a drug or for alcohol. So it is important, and we find that because families are interested and passionate and want to understand what addiction and alcoholism is, in understanding the disease, it makes it easier for and an easier recovery for the addict or alcoholic, because it facilitates an understanding and also a detachment, in that families will know that they don't have to mollycoddle, they don't have to babysit or police their loved one when they've left rehab. They have to trust that their loved one will make sane choices in not using drugs. However, being educated and interested in what the disease of addiction is will greatly enhance the sustainability of your loved one's recovery. It's always good to know, and it's always good to ask questions.